March, cancer mortality rates across the country have hit a record low. Here to tell us what has caused that drop is oncologist Dr. Monique Spillman from Texas Oncology. Thank you for being here today.
Thank you for having me.
So Dr. Spillman, tell us kind of your background, what you mostly focus on, and how long you've been with Texas Oncology.
So I'm an attending gynecologic oncologist, so I take care of women with cancer, and I've been with Texas Oncology for about 5 years now, but I'm a local girl.
All right, so this cancer rate, we've even done national stories on this, now getting kind of a local angle. So this big drop, how significant is this for your field?
This is amazing. It's the largest drop we've ever seen in a single year. It was about 2.7% in overall cancer deaths. So any patient we can save from a cancer death is worthwhile, but to save that many in 1 year is amazing.
So let's talk about the why. Why do you think these rates are dropping?
It's a triple threat. One is prevention, so vaccines are very important. The second is early detection, so having better lung cancer screening, for instance, or better mammography, and then better drugs. So we've had blockbuster new drugs coming out.
And you said lung cancer is the main one that really has seen a drop.
It is the main driver, so it was over half of the rate of decline of death.
And why do you, what is it about lung cancer that people are really, I guess, early detection, stopping smoking, what else?
Stopping smoking was a big part of that, so the prevention. But we also have new immunotherapy drugs that have driven a lot of the decrease in cancer mortality. So people are living longer with cancer.
And so you obviously talked about the vaccine, the HPV vaccine. Let's talk about that and some of the research that's come out of that.
So HPV vaccine has been a blockbuster for gynecologic malignancies. So women should be getting this vaccine as well as men, because we found there's a connection with decreases in cervical cancer for women as well as head and neck cancer, mainly in a male population.
And what age? I mean, obviously you get it when you're younger, but what if people are older and haven't gotten that vaccine yet?
So the FDA has approved it for as young as 9 years old, and it is covered up through the early 20s. So, but there's no age limit of when you can get it, but it's most important to have it before you have an HPV infection.
And let's talk about Texas Oncology. What are some things that y'all have been doing or you've been seeing in your clinic that's really maybe helped this cancer rate drop?
Yes, so Texas Oncology is a multidisciplinary practice, so we have many different types of oncologists, and we all work together, and we work together to have the best imaging. We have clinical trials, and we've been heavily involved in the immunotherapy trials. And if a patient happens to have more than one type of cancer, we can take care of all of that in one practice setting.
And so being a cancer doctor, what do these numbers really mean to you and seeing your patients live so much longer?
It means that my ladies get to see the graduation. They get to see the child grow up. They get to see the first grandchild born, and that is a gift that I will never forget.
All right, well, thank you for being here today. I know you're a busy woman. We had to do some scheduling and rearrangement. I'm sure you have a lot of patients you have to see here in the Key City, but thank you for being here.